Okay, today I'll be doing a sterile dressing change. I will first check my physician's orders. After that, I will enter my patient's room, provide patient privacy, perform hand hygiene, introduce myself to my patient. I will then identify my patient, and then I'll explain what I'm doing to my patient. I will let them know this is a sterile dressing change. It's a sterile technique. I will ask them not to reach into my sterile field. I will then ask the patient if he has any pain. If they do, I'll give them pain medication and come back at a later time to do the sterile dressing change. After that, I will check my supplies to make sure that they are in date, not soiled or contaminated. After I do this, I'll take my biohazard bag and place it at the foot of the bed so I can dispose of my soiled dressings. After that, I will raise the patient's bed to an appropriate working height. And I will lower the side rail. I will then perform hand hygiene and set up my sterile field. Set this container in the back corner of my sterile field so I can pour my solution in there. I will reach around, pour solution in. I want to make sure the label is in my hand so I can't possibly damage the label where it's ineligible. After this, I want to perform hand hygiene and put on gloves and check the dressing. Sheet bag. When I'm checking the dressing, I will want to pull away from my patient and I want to assess for coca. I will discard into my biohazard bag. I will check the bandage away from the patient, assess for coca. I will check the bandage away from the patient, assess for coca. I will then discard my gloves into my biohazard bag. I will then put on a new pair of gloves. And the reason I'm doing this is so I can palpate the area, check for any tenderness or any swelling, pain, anything like that. And I'll be checking for Rita while I'm doing this. I just want to palpate the area, make sure there's no tenderness or pain, anything in that nature. I will dispose of these gloves. And then I will do my sterile gloves. I will perform hand hygiene before I do this. I will have a dirty hand and a clean hand. I will take a gauze, drop or dip in my solution, come around, drop to my dirty hand. I will clean the incision first. I will discard into my bag. I will take another gauze, dip it in solution, drop in dirty hand, clean one side of the incision, drop into my bag. I will take another gauze, dip in the solution, drop to my dirty hand, clean this side, dispose in the bag. Now I will dry the area. Incision first. One side. Opposite side. Okay, then I will ball up this hand. This will now be my dirty hand. I will take a gauze, drop on the incision, take another gauze, drop on the incision. I will then take my ABD pad and place it on my incision. And now I'm done with my sterile gloves. I will take them off and dispose of them. I will now tape down the new dressing. After I do this, I will write the date of change and who changed it. I'll then cover my patient up. I will then put on gloves. I will raise the side rail, lower the patient's bed to a comfortable position. I will then fold up my sterile area and trash it into an appropriate bin. I will then take my biohazard bag, tie it up, and put it in an appropriate bin as well. I will then position call bell, perform hand hygiene, and I will document appropriately.